Hi, I'm Kelly Kelleher, a pediatrician at Nationwide Children's Hospital in Columbus, Ohio. At most hospitals, this is a patient. But at Nationwide Children's Hospital, this is one of our most important patients, our neighborhood. Neighborhood effect syndrome, characterized by symptoms of poverty, including blight, housing insecurity, racial segregation, trauma, violence in poorly performing schools, and environmental toxins, has debilitating consequences on child health. Healthcare providers frequently encounter challenges to caring for children from affected neighborhoods. These children often experience poorer outcomes compared to their peers in unaffected neighborhoods. Historically, institutions have been largely ineffective in changing these outcomes with one child at a time tactics. The Southern Orchards neighborhood, right by the hospital, is one neighborhood ill from neighborhood effects syndrome. The neighborhood had high rates of poverty and violent crime. Houses were boarded up and vacant. You didn't see kids playing outside much. To improve outcomes for these children, Nationwide Children's leaders, with community partners, decided to address neighborhood effects syndrome by treating this neighborhood as a patient. In 2008, Nationwide Children's began collaborating with residents, government entities, and social service agencies to develop the Healthy Neighborhoods, Healthy Families initiative. This also coincided with the hospital assuming all financial risk for Medicaid children in this neighborhood, covering most of them through its accountable care organization. It became clear that the neighborhood effect found in Southern Orchards was driven by the lack of housing stability in the neighborhood, which had been exacerbated by the housing crisis. Our collaboration committed to 5 therapeutic interventions to impact different segments of the neighborhood's housing market. First, the home repair program, home rehabilitation and home ownership, home construction program, an affordable rental housing program, and finally, home and career development building. This study describes the first $23 million from all the partners that's been invested in upgrading more than 300 homes to date. We've reduced the vacancy rate from 27% to 6%, and it's great to see kids playing outside again. With partners, an additional $10 million has been invested for a 58-unit affordable housing complex with on-site workforce development training to help people in the neighborhood get jobs at the hospital and nearby employers to ensure income. Our next big challenge is to continue growing this initiative and to measure outcomes in the neighborhood. We want to continue improving the social determinants of health as one of the most important ways to help children.